My name is Isra Ahmed. I am a prosthodontist. I opened up this practice back in 2020. I would say my practice is very personalized and very boutique-like, and I'm definitely somebody that treats one case at a time. Predictable outcomes come from well-executed plans. DTX Studio is actually one of my favorite tools to use, really. A lot of it has to do with predictability for your restorations, right? You're able to see a patient and you're able to confidently look at them in the eye and say, you know what, I can provide that for you. And this is how it's gonna turn out, even before you even do anything. That to me is the power of digital dentistry. And that's what DTX Studio is. There are many implant companies out there, but Nobel stands out. Let's talk about why. The clinical problems we face generally in dentistry with zirconia is it's not translucent enough, or it's translucent enough but not strong enough, right? That's one problem that it intrinsically solves. The other problem is that this particular puck is actually multi-layered, meaning it has multiple hues of colors within it. Right off from the oven, it looks good. You don't need to stain it, you don't need to do a whole lot to it. The fact that we're able to actually stack porcelain onto it without having it crack or chip or break, that's another big deal. Cements have been known to cause peri-implantitis, meaning failures of implants, right? Failures that we can't really recover from. We want to mitigate these risks by actually having a mechanical screw that retains the restoration rather than the cement. If I'm able to angle the screw so that it becomes in a place that is more accessible for me as a provider, maybe because the patient is not able to open as wide in order for me to put down the screw and torque it, or maybe because the screw channel comes off in a place where it's actually visible to the public. And now I want to actually bring it back in a place where I can actually hide it to make it more aesthetic. And so for a long time, we were not able to do that in dentistry. And the Nobel Zirconia Bridge, we're able to correct it up to 25 degrees, which is monumental. I recently seated a full arch zirconia bridge, actually on my own mother. It's her smile, because it's planned based on her teeth. She's able to get a second chance at having teeth that actually work for her and not have to be in a removable appliance for the rest of her life. Doing this for so long now, it doesn't ever get old. The reactions that stand out the most when my patients actually get their final restoration is when they look in the mirror and they go silent. They're in awe. They're speechless. They can't utter their words, and you can just see it in their face.